Hello and welcome to the Dissect and Connect podcast. I'm your host, Mike Wade. This is the podcast where we explore population health issues impacting your community. The Dissect and Connect podcast is a service of Montgomery County Prevention Partners and New River Valley Community Services. Our podcast is made possible through a grant from Carilion Clinic. The views expressed in this podcast may not necessarily reflect the views of Carilion Clinic. Tina King has served as Executive Director for the New River Valley Agency on Aging since 2006 and has worked with the agency since 1983. She completed her Bachelor of Science degree from the University of Tennessee, Knoxville, and her graduate work at Virginia Tech in 2002, earning a Master's of Science degree in Education with a concentration in health promotion and public health. In addition to her work with the Agency on Aging, Tina serves on several state, regional, and local councils and boards, including Chair for the Virginia Tech Center for Gerontology Futures Board, the Virginia Association of Area Agencies on Aging, the Southeastern Association of Area Agencies on Aging, the Radford University School of Social Work Professional Advisory Council, New River Community College Human Services Advisory Committee, and the New River Valley Aging in Place Leadership Team. Tina resides in Pulaski County with her husband Cecil, who is a cattle and sheep farmer, and her beloved dog Peaches. Tina, welcome to the Dissect and Connect podcast.
Thank you, Mike. I really appreciate the opportunity to be with you today and to talk about some information that would be useful to older adults and perhaps their caregivers in the New River Valley.
Well, we're very honored to have you on the show, so thank you again for taking the time to talk to us. I quickly just wanted to jump in with a question that I'm asking of all of my guests recently. It's the topic of the times, I suppose. How have you personally been impacted by the COVID-19 pandemic?
Well, obviously, as others, staying at home a lot more, having contact more virtually, even with my family and friends, spending a lot more time outdoors, though, enjoying some downtime with pets and spouse and doing some hiking on more isolated trails, if you will. So kind of been a mix of challenges and some silver linings.
Yeah, it's not all bad, I suppose.
No.
Tina, for folks who might not be familiar with the Agency on Aging, I was hoping you could maybe take a few minutes to give us kind of an overview of your agency and talk about some of your key programs and services.
Sure. Well, the New River Valley Agency on Aging has really been around for quite a while, since 1975, and we're a public nonprofit, and our mission is to enhance the lives of older adults, adults with disabilities, and their families and the care supporters that work with them to provide advocacy and information and services. And we're one of 25 area agencies on aging in Virginia and over 600 throughout the nation. Our service area covers the counties of Giles and Floyd, Montgomery and Pulaski, and the city of Bradford. We actually have 8 local governments that appoint citizens to our board of directors. We do provide an array of services to help individuals to achieve maximum independence and to enhance their quality of life and just help them maintain their dignity. And many of our direct services do have an age criteria starting at age 60. However, other services that we provide, really the criteria is either the person has Medicare or has a disability or is a caregiver. So that encompasses quite a large population.
Right.
We do categorize our services in 3 different areas. We have in-home and community-based support services. We have advocacy services and education services, and then some special programs and projects that just help meet and supplement the needs of older adults that we serve. And then again, particularly those that are most vulnerable and those that are confined to their home and maybe also experiencing some economic challenges.
You do quite a bit, and probably a lot of things that go unnoticed are maybe off the radar for most people, but you all are incredibly active in the community. What are some of the biggest challenges that you see older adults in our communities faced with?
Well, even before COVID-19 concerns with keeping everyone safe, we have already seen the challenges with social isolation
Mm-hmm.
for more of our older, vulnerable adults, and also some adults with disabilities and their inability to maybe leave their home for various reasons. And also, while I don't want to undersell the fact that there are many older adults and adults with disabilities that do have the capability to use technology, many of the individuals that we serve either don't have the capability, don't have access to the internet, or are economically unable to afford things like the internet and smartphones and tablets to keep connected to their community. And as a result, even finding individuals and having a contact with them to let them know about the services and the things that we can do to help them stay socially connected, meet their basic needs, maybe help them address some of their economic challenges.
Mm-hmm.
Those are things that were already there
Right.
before the COVID-19 concerns, but certainly are being heightened at this point.
Sure. As far as being able to reach the older adults in our communities, is the biggest challenge for your agency just a general lack of awareness?
I do believe there is a lack of awareness. We're working really hard to increase
Mm-hmm.
the visibility of our agency through certainly social media, through the newsprint, word of mouth, through volunteers and ambassadors, if you will, that are
Mm-hmm.
working within our programs. But yes, I think that many people, even though we've been around since 1975, are very unfamiliar with the fact that there's even an agency that can work with older adults and concerns that they might have, least of all to know what that array of services would include.
Right. And you've been at this, as I shared with our listeners at the beginning of the show, you've been with the agency since 1983. How have things changed in that time?
We've definitely had quite a bit of growth. In the beginning, the primary services that were offered were nutrition services,
Mm-hmm.
or what we now call our Friendship Cafe, which is a group program that brings older adults together in a setting for social activities, health and nutrition related information, and meals, of course, lunch
Mm-hmm.
meals. But so it's grown from that into also a home delivered component, to providing medical transportation for non-emergency appointments, shopping trips, certainly other in-home services such as homemaker, care coordination services, respite care. We also have a mobility coordination program that helps people find and understand what their transportation options are. We have added a telephone insurance program.
Mm-hmm.
We've taken on a long-term care ombudsman program, working with folks who are in long-term care facilities and their families to resolve quality of care issues and concerns that might arise. We've expanded to have elder abuse prevention services, legal services, health insurance counseling, and a benefits enrollment center, to name just a few. So we've grown considerably in terms of what we have to offer and staffing. Our reach in terms of being out into the 4 counties in the city of Bradford has not changed.
Mm-hmm.
We've been able, of course, to serve those areas throughout our history of our organization. So, we've expansion and numbers of people being served in each of those programs are growing considerably. Primarily, I don't really think so much through increased awareness, but just the increased population numbers
Right.
of older adults.
Right.
For those who are familiar with population numbers, we're no different in the New River Valley than in other areas, and probably in some pockets have a higher number of individuals age 65 and older proportionately in the population than many other counties. Some of our counties, the population is made up of about 30% of older adults aged 65 and older.
Mm-hmm.
Some as much as 25%. So that will continue to grow, and just the sheer magnitude of people needing assistance with Medicare concerns, some basic care needs, and finding transportation options will continue to grow.
Yeah, it's kind of a national trend, really, that we are a rapidly aging group of people.
That's correct. We are. And, with that does come some challenges, but there are also some very good positive aspects to that as well. If we can all recognize, what older adults have to offer, even those that are the most vulnerable and who might not be as apparently active in our community,
mm-hmm.
There's much wisdom, much knowledge, many skills to be gained from our older adults. So it's a two-way street.
And one of the challenges that you and I have had some discussions about previously is around the issue of many older adults in our communities who are acting as the primary caregivers for school-aged children these days.
Correct. There's a pretty high number, especially there again in some areas that we serve, with grandparents raising their grandchildren, in some cases great-grandparents raising their children. They're not all considered older adults, but many of them are, of course. And those challenges that arise just in parenting in general are there.
Mm-hmm.
In addition to many of these haven't parented for years, and having some support in the community and having the resources that they might need with that challenge is really important. So we're seeing more of that.
It is Older Adult Month and Mental Health Month. We're recording this in May, and a couple of things that came to light in a webinar that I think you also attended yesterday around social isolation, which we've talked about a little bit already, being a primary concern for older adults, particularly around things like suicide, binge drinking, marijuana, and even opioid use. So I just want to talk a little bit more about the specific concerns related to mental health for the older adult population, and maybe some of the things that we can do as supportive caregivers, family members, friends, neighbors to help maybe bring some awareness to those issues.
Certainly. Well, the issues that you mentioned, substance abuse issues and more serious mental health concerns are vital to be addressed in the older adult community. But additionally, that looking at the relationship of how for many social isolation and loneliness can impact either being a causative factor in or exacerbating those conditions. And, I suppose, and I mentioned a silver lining, I think because so many people of all ages have experienced this social isolation that we all have lately, they can really better grasp what it's like for older adults.
Great point.
And can really hopefully start to understand just how important it is to stay connected in some way to others of all ages, so that others can also have that sense of purpose even while they're staying at home or having to be confined at home. And I think it's important to think about that there's already about 30% of older adults aged 65 and older in the United States that live alone. They may not necessarily feel socially isolated or lonely, but really loneliness is more prevalent among those who are socially isolated. So I think it's kind of a safe assumption that there would be many of those that are. But it's also important to note that older adults can feel lonely even when they're surrounded by families and friends. And just before I move on to another point that you made and asked about, I think it's really important to establish the difference in being lonely and being socially isolated. While social isolation is like that objective physical separation from other people, loneliness is more of a distressed or a subjective distress feeling of being alone or being separated. And ongoing social isolation can certainly lead to loneliness, and it can impact a person's mental and physical health and their cognitive abilities in really detrimental ways, and especially if it is a chronic situation. And so some of those things that you mentioned, the substance abuse, some other suicidal tendencies and those things are definitely impacted or related, I do believe, to some social isolation, this feeling of loneliness, and maybe loss of purpose. So I think the other point that you mentioned is, so what can we do? Maybe as a community, is that from that perspective?
Yes.
To help address some of these things. I believe prevention and really on the front end of trying to understand social isolation and loneliness and some of the challenges that older adults are facing with loss in their lives in regard to perhaps loss of spouses or partners and loss of friends and loss of maybe their physical abilities. And understanding the depth of how those losses can impact them. But then also reaching out as family members and friends and neighbors and care providers and trying to help maintain that social connection if at all possible. But while we would advocate that, I think it's really, really important to respect the older adults' autonomy and their privacy. So it's a fine line, if you will. But I believe there are ways that from a very informal level of trying to keep in touch by telephone, by offering assistance as needed or as accepted to maybe pick up groceries, pick up things for them. But I think the most important part is just being present, just giving them a platform, if you will, if they want to open up and talk about the things that are important to them, to maybe help establish their sense of purpose and helping others to understand that they've had many challenges in life. And through those challenges, they've picked up a lot of wisdom, a lot of resilience. And even now, I've been involved in our telephone assurance calls, and it's been so rewarding. I call about 25 individuals. And I've found, of course, just as basic as it is with other communication, you've got to establish that sense of trust. You've got to try to find that link of commonality. But most important, that gift of time and that gift of being open to what they want to talk about and the things that are important to them. And each week, I've been doing this for, since mid-March. Each week, my phone calls get longer and longer. It takes much more time, but I love it. It is such a positive experience and has had such a positive impact. So I think that as a community, if we could just realize not to be afraid of making contacts as we can and reaching out and offering support, but just know that many of the older adults that would have that contact have so much more to give back and are so positive in the ways that they respond to that outreach.
Yeah, I mean, it seems to really come down to basic empathy and kindness. Wouldn't you agree?
Absolutely, which is so important in any interaction that we have in any population. But I think sometimes, in our society, I think we all know there's ageism. There are stereotypical thoughts surrounding aging and people who are older and maybe the old, if you will, or folks who are maybe more out of touch with what's going on. And sometimes we latch onto that rather than remembering that they are each individuals and have so many rich life experiences that regardless of their circumstance, there is much that they have to offer back to us.
That's really well said, Tina. And I think the advent of technology certainly has helped with that in some ways. That some older adults are comfortable using things like social media and technology to stay in touch with loved ones or folks who are close to them. But I also like the point that you made about it not being something that's forced to the point that it feels like you're nagging the older
Right.
adult in your life that you care about, that you're giving them an opportunity to engage at a level that they're comfortable with.
Right. And of course, it's more challenging right now just because of observing the safety of both the older adult and
Mm-hmm.
whomever might be trying to make contact and reach out. But there are definitely ways to do it, telephonically, of course, and with some older adults, there are those they do have the ability and do have the equipment to FaceTime or to Skype. But the other thing, if in such certain situations, if there's not too much risk involved,
Mm-hmm.
is just maybe trying to arrange a visit outside with an older adult, just getting them outside of their home and walking with them, keeping the social distancing in mind and
Right.
those kinds of things. There still could be some human interaction, face to face time, but just observing some precautions. And I know weather and other factors considered, many older adults would welcome that. But you mentioned the use of technology, and one healthy way of, or one way of really encouraging healthy endeavors with some older adults that are open to it is either helping them set up videos or knowing how to use YouTubes to do some exercising.
Mm-hmm.
Maybe just calling them on the phone and doing some exercises with them. We're going to do some armchair exercises, and this is what that looks like. Or let's do some marching in place, or let's do some stretching. Just something to engage them in something that is healthy, something that they can feel productive in, and hopefully get them feeling better as well.
So if you had a magic wand, Tina, and you could wave it to improve the conditions, the situation for older adults living in the New River Valley, what would you do? What would that look like?
Good question, Mike. I know that from some studies that have been done that a high percentage, almost 90% of older adults that were surveyed indicate they want to stay in their homes for as long as possible, as independently as possible, but yet stay socially connected, many of them. And so I would love to be able to provide any and all through our agency and through other community supports an avenue to meet the needs, and they would be varied, of course, because there's many unique needs, to help older adults do that. And there are really 4 key areas that have been identified, and one of those is housing, safe, affordable, accessible housing to help as one goes through different stages and of maybe differing physical abilities. The next is transportation options, because we know that older adults, there'll come a time when they can't safely drive. So what kind of options can be provided for them, especially in rural areas where there isn't public transport? So really, really trying to expand on that. Going back to the housing, while many older adults can afford to make adjustments in their homes to adapt to their aging needs, finding reliable sources to help with that can be an issue. For those who can't afford it, having a robust home repair program, a program that can help with the accessibility issues that are needed to be put in place. And then jumping back to transportation, just as I said, expanding options. Then looking at the healthcare affordability and accessibility, helping people to understand more about that prevention aspect of being healthy and learn both mentally and physically from a prevention standpoint.
Right.
And then last, that social connectiveness piece that we've already talked quite a bit about, and being able to offer physical and now more virtual ways for people to stay socially connected and help them with the resources needed to do that if that's something that they want to do. So yeah, we just want to really enhance that aging experience that if we're all fortunate enough to have, we will. We want caregivers or supporters to be supported in their endeavors to help their loved ones. And it's so multifaceted. So it would be really hard, even with that magic wand, for me to say, oh, this is what I want to do. But really, I think just having a broader capacity as an agency and as a community to respond to the sometimes very unique needs of older adults and their care supporters. And just to realize that not only do we want to make or to have the New River Valley be a place that is wonderful to grow up, but it's also a wonderful place to grow older.
Well, I think that's a wonderful way to wrap up our conversation, Tina. Just maybe one final word of wisdom or a takeaway for our listeners that you would like to share?
Well, I think, and this can also be something that if people really want to know more about aging in place and those 4 areas of concern or things to be addressed, then we have a great way for them to get involved. There is an Aging in Place website that they can access that has an Aging in Place workbook that's free to download, or we can provide a hard copy of that for individuals to look at and to be considering things that are associated in those 4 categories for themselves or others that they might be assisting. The hard copy is very inexpensive. It's just for the cost of the reproduction and the printing of the material. And then there are videos that can be utilized. So for folks who might not be ready yet to look at services or supports formally, there are certainly ways to be looking at preparation, looking at resources that might be available in the future to them. So I would really like for folks to understand that there is access to that to help with aging in place concerns.
Yeah, and if you'd be so kind as to share some of those, I'll be sure to add those to the show notes for this episode.
Sure. I'll give you that link to that website as well.
Great.
But, in our discussion today, I mentioned some of our direct services, both in-home, community-based advocacy, and so forth, without really going into detail. So I'd like to encourage folks that want to know more to certainly call us and or visit our website or go to Facebook if they're utilizing social media, if they want to look at some real-time things that if they want to get involved, so to speak, or learn what kind of services might be of interest and of help to them. They can call us at 540-980-7720. Or if they use email, I can give you that address, or I can send that along with a link to the Aging in Place website.
Yeah, please pass that along and we'll include that with the show notes.
Okay, we'll definitely do that.
Well, Tina, thank you so much for taking time to share with us today and tell us a little bit more about your agency and some of the concerns and considerations for the older adults living in our communities. Certainly appreciate your insight and your experience. It's just very helpful to hear that from you, and certainly appreciate all that you and your team at the Agency on Aging do for our communities.
Thank you, Mike. I appreciate this opportunity, and I think I'd be remiss if I didn't wrap up by saying that during this COVID-19 pandemic, it has become more apparent than ever that a village approach is needed to address some programming and service concerns. I think not only with what we're doing, but some other agencies and entities are doing. And I could not be prouder or happier for those who have stepped up in other agencies, businesses, and faith-based organizations that have really helped us keep the pace and keep things going in some very unique ways and very giving ways. So we can't do this alone, and we're very, very thankful for those who help us approach it collectively.
Well, I'm so glad you took time to share that, and it really is true. It's said a lot, but we really are in this together.
Yes. So look forward to some future endeavors and finding more ways to address the mental health and other needs of older adults.
Well, hopefully at some point in the future we can have you back on for another interview.
Thanks, Mike. I appreciate it.
Thank you, Tina. We hope you've enjoyed this episode of the Dissect and Connect podcast. To learn more about Montgomery County Prevention Partners or New River Valley Community Services, be sure to check us out on Facebook or visit nrvcs.org/podcast.